health problem. Why must the government make dementia a priority? Almost 1 million people are living with the condition in the UK. We expect this to rise to 1.4 million by 2040 due to our ageing population. Dementia costs the UK £42 billion a year, rising to more than £90 billion by 2040. 1 in 3 people born today will develop dementia, and it is a leading cause of death. As things stand currently, dementia presents us with 3 broad challenges. The first is social care, an issue that many global lords have already touched on as a clear omission in the gracious speech. 70% of residents in older age care homes in England have dementia. Only 45% of care staff are currently recorded as having any level of appropriate training. So what could be the solution? A long-term workforce strategy. Social care staff should be required to undertake dementia training mapped to the Dementia Training Standards Framework or equivalent. Second, a sustainable funding model for quality personalised care which pools the risk of care costs and is centred on achieving affordable care for everyone living with dementia. The next challenge is diagnosis. More than 1 in 3 people living with dementia in England are currently undiagnosed. There is a significant regional variation in diagnosis rates, moreover, by more than 40%. What could be the solution? A target for a more ambitious dementia diagnosis rate should be a government priority. Secondly, a commitment to better training for healthcare professionals. Thirdly, funding for public awareness campaigns. Fourthly, increasing quality and quantity of diagnosis data collection and publication. The final challenge is treatment. There are drugs that, for the first time, can slow the progression of Alzheimer's disease in the earlier stages of diagnosis. Tens of thousands of UK citizens could potentially benefit from these drugs if they were approved. However, the healthcare system is not yet ready to deliver such treatments due to the lack of early diagnosis and specialist diagnostics. What could be the solution? 1. A satisfactory plan should be developed by NHS England and Department for Health and Social Care to be thoroughly prepared and ready to start to deliver these new treatments for dementia. Secondly, the current drugs being assessed are just the beginning. Though welcome, they do not halt the neurodegeneration process, they only slow it down. However, there is the very real prospect, my lords, still at the research age admittedly, of innovative treatments that could go far more and be much more effective, perhaps even halting cell death altogether. The biggest barrier to progressing such game-changing therapy at pace is quite simply and inevitably inadequate funding. To conclude, my lords, dementia is the biggest unmet clinical need of our time, and as such it surely should have been a high priority in government plans in the gracious speech. Whilst diseases such as cancer are serious, often disabling, frequently terminal, you can still reminisce over old photographs, still spend meaningful and prescient time with your grandchildren. These life-enhancing moments are gradually closed off to an individual with dementia, and it is a spectre that haunts us all. We need to invest funds immediately in rising to the 3 challenges of social care, diagnosis, and above all, innovative and effective treatment. So we could finally offer perhaps our grandchildren one day asking, as we did in the past for smallpox and polio, was Alzheimer's ever a problem?